Hello everyone, welcome to another interesting episode of the Anti-Pharmacist Podcast. It's another new week and I hope that you had a nice weekend with friends, family, or by yourself. Yes, so today I'll be talking about a topic that is kind of sensitive, okay? Most people don't even want to talk about it sometimes. You know, when somebody comes into the pharmacy and asks for specific medications for this, they feel like I should not be complaining about this. But it happens, right? And once it happens, you have to do something about it. Well, what I'm talking about today is erectile dysfunction. Yes. And of course, it happens in men. It's men that get erection, right? It's been baffling lately that the age at which this occurs has become younger, in the sense that we see more of younger guys coming into the pharmacy, or going to see the healthcare professionals about erectile dysfunction. And one begins to wonder why this is. In the past, it used to be older men, maybe due to age or maybe due to some chronic conditions or some medications they take for this condition. But it's become common in younger guys. And I begin to wonder why. Which is why I will be taking you through what erectile dysfunction is and causes of erectile dysfunction, of course, how you can prevent them and how you can treat them, okay, so that you can understand and avoid it. It actually affects one's sexual life, negatively. It could ruin your intimacy with your partner, and it could even prevent you from having children if care is not taken, which is why I've decided to take it as a topic today. So work with me as I take you through understanding erectile dysfunction. Without further ado, let's get right into it. Simply put, erectile dysfunction is a sexual dysfunction that makes it difficult to get or maintain an erection. It is also known as impotence, okay? Of course, it happens in men because it is men that get erection. Yes. Now, in Nigeria, my country where I record this podcast from, about 1.5 million men come down with erectile dysfunction yearly. You might think that is a small number, but that is not. That is a lot. And worldwide, as of 2025, erectile dysfunction has been predicted to occur in approximately 322 million men. Just imagine that. Like I said, erectile dysfunctions have become more prevalent these days, especially in younger men, which should not be. And it is majorly due to some changes in lifestyle that I'll be talking about briefly, okay? Now, there are different types of erectile dysfunction. There's the physical erectile dysfunction, there's the psychogenic, and there's mixed. When we talk about physical erectile dysfunction, it is caused by different conditions and some physical activities, okay? Conditions like diabetes, like some heart diseases, like obesity can actually lead to erectile dysfunction, especially if you're taking some kind of medications for this condition. Erectile dysfunction actually comes as side effect to some of these medications. Some heart medications like beta blockers, like some calcium channel blockers, would lead to erectile dysfunction. And let me let you know that erectile dysfunction is not just about having difficulty in getting it up in the first place, but even maintaining the erection till the end of sexual intercourse also falls under the category of erectile dysfunction, okay? But it is usually treatable, alright, which I'll be getting to. But I was talking about physical causes of erectile dysfunction, right? Yes. So before I go into that, let me just briefly explain how erection happens. When a male is aroused, that is sexually excited, the brain sends messages down through the spinal cord, through the nerves in the pelvis to the penis. These messages cause changes in blood vessels of the penis. That is, the arteries supplying the penis now dilate, they get wider, which allows more blood flow into the penis. Muscles in the penis and the pelvis squeeze the veins which drain blood from the penis. which reduces the blood flow out of the penis. This causes blood to build up inside the tissues of the penis and increases the pressure inside the penis, which makes it firm and erect. So if there are problems with these nerves that supply the penis, or problem with blood flow to the penis, they can result to erectile dysfunction. Okay, which leads me to the physical causes of erectile dysfunction. About 80% of erectile dysfunctions are due to a physical cause, which includes reduced blood flow to the penis due to narrowing of blood vessels. That is called atherosclerosis. I talked about obesity being one of the conditions that could lead to erectile dysfunction. When you're obese, you have high level of low density lipoprotein in your body, which leads to like abnormal fats. This fat could break, causing plaques and blocking your blood vessels. This is what we call atherosclerosis, and this of course leads to narrowing of the blood vessels, which reduces blood flow to the penis and leading to erectile dysfunction. Okay, other causes of reduced blood flow to the penis could be smoking. With time your blood vessels get hardened, they are not as tensile as they should be, so the whole engorging, dilation and contraction will not be so possible anymore, leading to reduced blood flow at the end of the day. High blood pressure also could impede blood flow in the blood vessels, leading to erectile dysfunction. I've talked about high cholesterol, diabetes, and high blood pressure. They are interconnected in a way. Okay, high blood sugar would increase the viscosity of the blood, leading to high pressure in those vessels, also reducing the amount of blood that gets to your penis, which leads to erectile dysfunction. Also, age is a factor. Getting older, that as we get older, we lose muscle mass, we lose the ability of the muscle to contract or constrict effectively. So it happens a lot in older people. The strength is not there anymore and all of that. Another physical cause of erectile dysfunction is nerve damage. Okay, I talked about the brain sending signal down to the spinal cord and all of that. And you know that the spinal cord is a network of nerves. So if these nerves are damaged, no message is sent to the penis for erection. So diseases that cause nerve damage like multiple sclerosis, stroke, Parkinson's disease usually lead to erectile dysfunction, right? Because they affect the nerves. Nerve injury like spinal injury, fractured pelvis, radiotherapy to the genital area, which destroys some cells of the nerves there, that will lead to erectile dysfunction. Then low testosterone level is another cause, okay, which is why one should do their hormone profile test from time to time as well. As a man, don't just leave everything to chance. Or if you realize that you are experiencing erectile dysfunction, that could just be it. And low testosterone levels, can be caused by abuse of steroids. I talked about steroid abuse on earlier episodes on this podcast. You can check that out. The title of the episode is Dangers of Steroid Abuse. Go check it out, guys. When you abuse steroid, you take testosterone to build muscles. With time, your brain gets the idea that you don't need it to send signal to your pituitary gland anymore. So once the signal is not sent, the body doesn't produce enough testosterone, and with time, you will begin to have low testosterone level, which could eventually lead to low erection. Also, side effects of medications, like I've been mentioning, some medications like antidepressant, some blood pressure medications, some diuretic could lead to erectile dysfunction. Now, if you're taking these medications and you're experiencing erectile dysfunction, it is not for you to stop these medications. I know that side effects are one of the major reasons for non-adherence to medications. Go talk to your healthcare providers. They might have an alternative for you which will not have the side effect, or they might have another medication to counter that side effect. Okay, you will not, because you don't want to experience one side effect, harm yourself by discontinuing your medication. It is counterproductive, guys. Also, another physical cause of erectile dysfunction is complications of surgical or medical procedures. Okay, some people after undergoing prostate surgery could have nerve damage, which could eventually lead to erectile dysfunction. All right, alcohol and drug abuse. We can't say this enough. When you abuse alcohol and drugs like steroids, I've mentioned, marijuana, cocaine, heroin, they do more harm than good to your body. They destroy your cells, your muscles, and all of that, and they lead to erectile dysfunction. I think this is the major reason why it is common in younger guys now, because a lot of guys these days abuse alcohol. Many are drug addicts. This damage their cells, damages their blood vessels, and before you know it, they'll be trooping into the pharmacy to get medications for erectile dysfunction because they're not treating their bodies right. Another cause, physical cause of erectile dysfunction is cycling. Yes, sitting in the saddle too long, especially for long ride, can put pressure on the nerves that go to the penis. So if you're a cycler, please be careful. Take extra caution. If you could get something to protect your crotch, please do, for your future generation, okay, for the sake of procreation and for your own sake and your partner's too. All right, consider that cycling is a great, in fact, form of exercise, but do not do it to the detriment of yourself and your health. The last one is venous leak. That is, the blood leaves the penis too quickly, causing loss of an erection. Of course, blood gets to the penis, but it's like it drives back, like a backward pressure. That also happens. There is also one less common physical cause of erectile dysfunction called Peyronie disease. It is a condition in which fibrous scar tissue forms in the deeper tissues under the skin of the penis. It causes curved and painful erections, and it can make the penis shorter while erect. So because of this painful erection, this might send some signal of pain to the brain each time one is aroused, and can eventually lead to erectile dysfunction. All right, so that is another physical cause of erectile dysfunction, and it can be treated. Okay, those are the physical causes of erectile dysfunction. Now to the psychogenic causes. These are the ones that are caused by psychological issues. I've had patients come to me to complain that they actually just cannot get it up because maybe they are worried about something and all of that. They are part of wider mental health problems like depression, stress, for example, could lead to erectile dysfunction. There's also something called performance anxiety. Feeling anxious about not being able to get the erection or to satisfy your partner, could actually lead to you not being able to get the erection eventually. Issues with sexual intimacy, for example, people who have had embarrassing or traumatic experiences can find it difficult to get erection, especially maybe male children that have been abused when they were younger, victims of rape and all of that. It could lead to that. Of course, I've talked about anxiety. Some people that have, anxiety, that have been diagnosed clinically to have anxiety, they could also experience erectile dysfunction. People that have relationship problems, not just romantic relationships, even cordial relationships, all of this can put stress on your mind. This, as physical as it is, sexual intercourse is also a thing of the mind. So if your mind is not settled, it could lead to erectile dysfunction. Okay, all of these are also treatable. Okay, also science has shown that there might be a link between erectile dysfunction and heavy or problematic use of pornography. If you're one that watches pornography, studies have found that erectile dysfunction is more common in men who have symptoms of pornography addiction. Okay, so it is in your best interest to leave that habit because it will harm you in the long run. So this psychogenic erectile dysfunction can resolve once the cause has been resolved, like anxiety or depression. If it eases, erection usually restores. But some people may become more anxious or depressed after they have developed erectile dysfunction. So it's like a vicious cycle which worsens their symptoms and makes the whole thing persistent. So you should see your healthcare provider, especially your psychologist, for proper treatment. Okay, that is how it should be. Okay, there is also mixed erectile dysfunction, in which one may experience both physical and the psychogenic. All in all, you should seek treatment by visiting your healthcare provider on time. Okay, do not wait that, oh, let me find something else to use first, let me go and get one agbo or something like that. It may end up harming you, causing more harm than good. Okay, erectile dysfunction is more common as you get older. It happens in about 50% of men between the ages of 40 and 70, and about 70% of men aged 70 and above. But a lot of men do not seek medical help because they are embarrassed about it. Yes, this is me telling you the causes so that you can avoid it, so that it doesn't get to the stage in which you have to see your healthcare provider. Or even if you have it already, there's nothing to be ashamed of. Okay, healthcare providers are there to help you. We are trained professionals. Nobody will judge you that, oh, you have erectile dysfunction. We are here to help. Seek health advice. Do not listen to hearsays. Do not harm yourself by taking different concoctions that are more of alcohol than remedy. And you know, I mentioned that alcohol is one major cause of erectile dysfunction. So please be advised. Okay, so while mentioning the causes, I've actually talked about how to prevent erectile dysfunction. That is just it, guys. You know to avoid those things. Now, to the treatment of erectile dysfunction. The best way to treat erectile dysfunction is identifying the underlying cause. What caused the erectile dysfunction is a pointer to the treatment. It's just like reversing. Okay, if you've been a heavy drinker, if you've been smoking, of course you have to quit. If you have psychogenic erectile dysfunction, you know that, oh, you overthink things, you are anxious, or you are depressed, you have to talk to a psychologist or even to a sex therapist. Okay, and you could also do cardiovascular exercise. This is a vigorous exercise that lasts for about 45 minutes, which you have to do 3 times per week, which helps to reverse some cases of mild erectile dysfunction. These cardiovascular exercises may include brisk walking, jogging, swimming, bicycling, and jumping rope. Of course, when you're riding the bicycle, you will wear something to protect your crotch. Okay, then there is penile low intensity focused shockwave therapy. These ones, they use it to improve the blood flow to the penis using sound waves. These are advanced therapies. Okay, when you talk to your doctor, you talk to your therapist, they know the way to help you. Some even use penis pumps. Okay, they are called vacuum constriction devices, and they start to work almost immediately. There is also testosterone replacement therapy for those that have low testosterone. They are available as gels, as injections, as patches, as pellets. Okay, they help to replace testosterone, which help you to be able to send signal to your brain that, oh, an erection is needed at a particular time. Then there are penile implant. It's a surgical procedure in which devices are placed in the penis that help to make it erect when needed. Then there are penile creams that have substances that easily pass through the skin into the blood vessels of the penis and help it to be erect. Now, there are also medication. They can be injections, it can be tablets. When you visit your pharmacy, when you visit your doctor, they will give you the right medication. A lot of people know about some common ones, but those are not the only ones available. And need I tell you that if you abuse these medications, sometimes you may not be able to get it up naturally anymore unless you take those medications. So do not aim to depend on medications alone. It's not all the time Viagra today, Cialis tomorrow, Tadalis the day after. Some people even come and buy like a lot of packets. That is not advisable, guys. Try to do it naturally. That is the best way. There is another issue called priapism, when erection lasts longer than 2 to 4 hours and becomes painful, which can cause permanent damage to your penis that cannot be treated. Okay, you should take it easy on the erectile dysfunction meds and focus on the preventive strategies, because once you have priapism, you may not recover from it and you may lose erection forever, or you may need penile surgery just to be able to get it back. The only time to turn to meds is when they are prescribed or recommended by your healthcare provider. Don't see them as a norm to be taken, either you have erectile dysfunction or not. You are doing more harm to yourself than good, actually. Look at these preventive strategies that I've told you. Okay, reduce cholesterol, be more physically active, do those cardiovascular exercises, even if you do not have erectile dysfunction, just to prevent them. Maintain healthy weight, okay, so that you don't have obesity, which could cause plaques to form in your blood vessels. Get high quality sleep, eat healthy food with low saturated fats, eat fruits, vegetables, whole grains, and reduce or stop drinking. Then free your mind, okay? Do things, do relaxing activities, reduce stress, unwind with family and friends. When your mind is healthy, your body will be healthy as well. I can't say this enough. When you do all of this, erectile dysfunction will be a thing of the past, or you not even hear of it at all. I hope that you've learned a thing or two. Yes, I know this episode seems to be about the men, but that has not it at all.
And as a woman, it is important that you support your partner even if they have erectile dysfunction, because emotional support is actually very important at this time, so that they can overcome it. And as a man, do not hide from your partner. Do not hide the fact that you have erectile dysfunction from them, okay? Because you need their support to be able to cure it.
Females too can listen to it, share with your partners, because when sexual activity is impeded, it could affect the relationship, like I talked about earlier. So be sure to do all of this to prevent erectile dysfunction. And that is what I have for you today. But before I close, let me talk about World Cancer Day, which is celebrated every 4th of February to raise awareness about cancers in general. We all know that cancers are the bane of the existence of the 21st century. They are like the most dreaded illnesses of this time, because as of now, there is no certain cure for any type of cancer. We just have different treatments that aim to manage the cancers. Scientists keep working hard to make sure that they conquer cancers. There are different types. Virtually every cell in the body can become cancerous if care is not taken. And these cancers, they are like errant cells. They are cells that do not listen to instructions, so to speak, in the body. They overgrow and become tumors. And some may be benign while others are malignant. But it's the malignant tumors that are usually referred to as cancer. And according to the National Cancer Institute of the United States, there are over 200 cancers right now, usually classified according to the type of cells in which they occur or the area of the body in which they occur. The most common types of cancers that we know are the breast cancer, the prostate cancer, ovarian cancer, cervical cancer, lung cancer, bladder cancer, lymphomas, melanomas, leukemia, many types of cancer. Too many to actually count, guys. So the major thing to take note of is prevention. Yes, cancers are caused by a combination of environmental and genetic factors sometimes, but as much as it is in your power, try to avoid triggers, what we call risk factors for cancers. live as healthy as possible. Okay, avoid smoking, limit alcohol usage, eat balanced diet, exercise, so that your cells will behave as they should, and you reduce the probability of them becoming cancerous or becoming tumors. Okay, just do everything in your power to live healthy. Of course, genetics plays a key role, which is why we should do screenings from time to time, and different screenings for different types of cancers. So prevention, guys, is not just better than cure. Prevention actually is the cure in this day and age. So please do take note of this as we celebrate World Cancer Day on February 4th. I hope that you've learned a thing or two about erectile dysfunction and cancers as well. So please share, do well to comment under this episode. Let me know what you think. Let me know about what you're curious about. Ask your questions, leave your comments. Okay, have you had somebody who had erectile dysfunction? How did they overcome it? How did it make them feel? Just leave a comment or two under this episode. And after that, please do follow the podcast, leave a review. I love your stars, I love seeing them. Please do subscribe, guys, to my YouTube channel. I need your subscription. The more you subscribe, the more visible the channel gets to people. The algorithms suggest it to more people, and this information goes around. That's the aim of this podcast, guys, to educate you about your health, all round health. And why I choose these topics is because they are the cases that I see from time to time. People coming into the pharmacy to complain about them. Okay, and it is better that more people are aware so as to prevent. Because what pharmacy deals with first is prevention before we go to the cure. That's why we talk about vaccines, we talk about lifestyle modification. The last resort should be medications, guys. So please work with me, share the podcast, follow all my social media platforms on Facebook at Pharmacist Podcast, on Instagram at Pharmacist Podcast, on YouTube, subscribe to the Anti-Pharmacist Podcast channel. On X, I'm there as Pharm Podcaster. On TikTok, I am there as well as Anti-Pharmacist Podcast. And I have the LinkedIn page in my name, where I also disseminate health information, guys, not only about this podcast episodes, but also about different health topics that come to mind from time to time. Yes. Also, you can send your emails, questions, whatever it is that you have for me, invitations for collaboration to my mail at antipharmacistpodcast@gmail.com. As I said last week, I'll be starting Dear Anti-Pharmacist as a segment on the TGIF episode, which will be starting this Friday. So look forward to that, guys. It will be interesting, trust me. I have a lot of interesting things packaged for you this year, as I've always said. So please watch out for those and keep supporting me. Help me grow this podcast. Let us do this together. Anti-Pharmacist Podcast is on a mission of educating the world, not just Nigeria, about their health, about their medication from the pharmacist's perspective. Okay, so help me grow it, guys. I really appreciate your support till now. Thank you once again for listening up to this point. I hope that you have a nice week, and I'll see you on the next one. Till next time, stay healthy and God bless you.